Next up, we have the fantastic Samir Karki to introduce us to Bangladesh Sanitation, and is also from iDE. So welcome to the stage, Samir.
Thank you. Hi, my name is Samir Karki, and I work as Associate Director of Programs for iDE Bangladesh. Our pitch today is Development Impact Bond for Sanitation, driving national sanitation access with innovative financing. Let me start by introducing iDE. iDE is a global organization that co-creates with foundation, governments, individuals, for-profits, and non-profits to develop lasting solutions to poverty. We design and deliver market-based solutions in agriculture and WASH in 11 countries across Asia, Africa, and Central America. We are a globally integrated ecosystem of over 1,000 staff passionate about innovation and entrepreneurship. Under the WASH portfolio, our bottom line is to make substantial increase in people's quality of life by effectively increasing WASH adoption and behavior change, which we believe can best be accomplished by using markets to deliver solutions that people want and can afford. We work closely with local entrepreneurs that are part of the communities being served, and we have a long-term presence in each country we operate. Next slide, please. So 4 pillars of iDE include: we start with people using human-centered design. We design final solutions to the problems to develop deeper understanding of people's life. We design to context. Solutions are tailor-made to local contexts, including social environment. We believe in business delivering by mobilizing private sector by facilitating to market and cater towards the poor. And finally, we collect evidences and learn from the results. Next slide, please. The graph shows our results in improved sanitation space till date. We have catalyzed markets to sell more than 1 million toilets in 6 countries in the last 25 years. Next slide, please. Here's a quick summary of what DIBs are about. DIBs were introduced in the presentation before this one. However, I just want to summarize briefly. Basically, the model is an investor provides an upfront funding to implementer of a program. An evaluator measures the results of the implementer's program. If the results hit a target set before the implementation period, an outcome payer agrees to provide investor a return on their capital. As such, DIBs present an alternate pathway to funding. iDE has experience with DIB, which was presented in the previous presentation, and it's initiated world's first sanitation DIB. Next slide, please. The sanitation need in Bangladesh really needs immediate attention. The public and development sectors have made tremendous progress in promoting hygienic sanitation practices in recent years. However, the proportion of unimproved, limited, and basic latrines remains high at 68% of all households. ODF status is reached. However, we need people to move up the sanitation ladder from unimproved to improved sanitation facilities. With over 105 million people in Bangladesh, 71 million people do not have access to safely managed latrines. There are between 16 million households that need better latrines. Next slide, please. The proposed solution is nationally scaled, multiple award-winning approach of sanitation market system, which focus on catalyzing the country's private sector to lead the delivery of sustainable, low-cost WASH solutions for low-income consumers. The approach uses holistic framework and works across all concerned stakeholders to produce sustained impact long after the certain project timelines. There are 3 sectors: public, civil society, and private. Each sector has a unique strength and opportunities that can be overcome the challenges of the other sectors. Additionally, each of these sectors have layers at the national, macro, and regional, and at local levels for increased coherence and integration. There are 3 outputs: demand, supply, and support. The demand of improved products and services through consumer awareness and marketing. The supply of improved products are through capacity building of local WASH entrepreneurs, sales agents, village masons, to national latrine component manufacturers, and even international designers. And finally, we support the market through policies and regulation by working with government of Bangladesh and other bilateral agencies. Finally, the outcomes of the approach is scale, sustainability, and social welfare. Next slide, please. We received opportunity already to partially scale the approach. Bangladesh has in total 64 districts. 6 districts were covered in the phase 1, where 400,000 latrines were sold and installed. Similarly, 25 districts will be covered in phase 2 with funding from UNICEF and Swiss Agency for Development and Cooperation, STC, with a target of 1 million. The additional DIB fund will allow us to scale the approach to another 25 districts with target of additional 1 million toilets sold and installed. DIB can exploit the potential to scale the current model to a national level and at the same time explore innovative ways to accelerate the program. Next slide, please. It has a high social impact. According to World Bank report, financial loss to a family due to inadequate sanitation and hygiene in Bangladesh is 133.2 USD per year. This will also support Bangladesh to address SDG 6.2 challenge of raising access to safely managed sanitation. Next slide, please. As mentioned in the previous presentation, DIBS is feasible when certain conditions are met. The proposed idea meets the criteria of DIB, such as it has reasonable timeliness, interventions are innovative but previously demonstrated, relevant outcome data is available, and together with impact investors, iDE can facilitate negotiation with outcome buyers along with program performance outcome, which could be toilet sales, coverage, areas, and toilet entrepreneurship established. Next slide, please. What we're seeking for is an investment capital of 12 million. This is the cost estimated based on the current phase, and a willing investor to co-create DIB with iDE and the outcome buyer partners. Next slide, please. This initiative is driven by a diverse group of development professionals, and we hope to interact with you more and discuss further about this opportunity. Thank you once again.
Thank you, Samir. That was an excellent presentation. It was great to have you here today.